Hello, my name is Dr. Don Buford. I'm an orthopedic surgeon down in Dallas, Texas, and I run the Texas Orthobiologics Clinic there. The title of this presentation is Ultrasound-Guided Bone Marrow Aspiration, and what the plan is here is to review our current best practices for getting bone marrow in the clinic primarily, but we also use the same technique in the operating room. And this is a technique that has been published and validated by multiple researchers, and we have used successfully to teach to other clinicians over the past 10 to 15 years. These are my disclosures. They're available on the American Academy of Orthopedic Surgery website. The handout for this presentation can be found at buford.info/AOAO 9min, or you can scan the QR code seen on the screen here. You can also find this presentation along with many others on my free YouTube channel at Don Buford MD. So let's talk about some bone marrow aspirate facts first. The iliac crest has the highest concentration of mesenchymal stem cells and hematopoietic stem cells. The femur or tibia or humerus has only 40% of the cells that the iliac crest has. And so in real terms, what that means is you would need to draw 2.5 times the volume to match the stem cell recovery from the iliac crest. So even in surgery, my go-to source if I'm looking to get mesenchymal or medicinal stem cells is the iliac crest. Other best practices tips include using approximately 10,000 units of heparin per 60 cc's of bone marrow aspirate, using 10 cc syringes. The reason we use 10 cc syringes is because that's been shown to increase cellular recovery by up to 300%. Just that simple change of changing from a 60 cc to a 10 cc syringe can significantly improve your procedure. We also advise using a multi-depth and or a multi-site protocol to harvest bone marrow aspirate. We always centrifuge the marrow because we get a higher cellular recovery that way. And we also are investigating the concept of filtering the plasma to further increase some of the plasma proteins that are not normally increased by the office-based centrifuging process. By filtering the plasma, we can further increase the concentration of some of the large plasma proteins, particularly IRAP and A2M. So what is bone marrow aspirate concentrate? Well, this is bone marrow that is centrifuged in order to raise the concentration of cells, both MSCs and HSCs. It also raises the concentration of platelets. Remember, there are some platelets in bone marrow aspirate. It also allows for plasma protein concentration by then filtering the plasma, which is what we were just talking about. And then also, perhaps equally as important, it allows for the removal of red blood cells and any debris from the bone marrow aspirate process. This is some literature that was published back in 2013, and it was an excellent review of how to maximize these procedures. It was published by Philippe Hernigau, and this is the paper that really made it accepted that using these smaller volume syringes led to better cellular recovery from the bone marrow. So in this paper, they documented that a mesenchymal stem cell recovery was 300% higher when using 10 cc syringes versus a 50 cc syringe with a very high statistical significance. This is a paper that we published, our team with Matt Murphy and Jess Terrasas back in 2015. And the recommendations out of this paper were to use iliac crest, to use 10 cc syringes, and to always centrifuge the aspirate. Doing those three things gave us the most control in impacting the outcomes of our bone marrow aspiration, gave us the best cellular recovery. On the left is an MRI scan showing, as if the patient's in a prone position, the safety margin that we have when we teach our specific ultrasound-guided posterior iliac crest bone marrow aspiration technique. You can see that in this example MRI scan on the left, in red, there's 4 centimeters of space from the posterior iliac crest down to the SI joint if you go straight top to bottom. As a result, we designed a technique with over a 50% safety margin where we only had to go a total of 16 millimeters, leaving us a a significant safety margin and also allowed us to standardize not only the entry location, but also the angle of recovery, meaning that the Jamshidi needle is angled straight up and down as opposed to off center, any amount varying from 15 to 25 degrees. The reason for doing this as a teaching technique is because it is much easier to teach someone a 0-degree angle than it is to teach someone a 22-degree angle. This busy slide details the full Eupica technique. So I won't go through it all. It's here just as a reference, but the basic concept is that at each level, we draw twice, and we draw 7 to 8 cc's at each level. The reason we do that is really specific to the Jamshidi that we're using that has holes on opposite sides. So we draw 7 cc's here, and then we rotate and draw 7 cc's here. So at the end of that double draw, we've harvested circumferentially at that level. Then we go an extra 5 millimeters deeper and do the same process again. These are the numbers on average that we received when we tested this technique and validated by doing CFUs in the lab. We found that our average CFU per cc was 4,907, which is well within the range of published CFUs using good technique. We found that we were able to increase the cellular concentration by a factor of 6 by centrifuging the marrow. That's why centrifuging the marrow is important. We could not otherwise achieve a 6-fold increase in cellular concentration. Here's another author, actually 2 authors, Drs. Ott and Barry Garcia, who looked at this same ultrasound-guided posterior iliac crest technique. They ran their own clinical trials, and they basically validated the results that we found in our trials. And so as a result, they concluded that they could endorse the Eupica technique as a valuable and viable method for bone marrow aspiration. So it works in Dallas, works in Austin, works in Vero Beach, Florida, and I think it works just about anywhere. So what about some closing thoughts? Well, number one, bone marrow procedures rely on MSC and HSC cell types for success, but don't forget about the plasma proteins like IRAP and A2M. They definitely matter and play a clinical role. We're continuing to define exactly what that clinical role is. Remember that both MSCs and HSCs in bone marrow aspirate concentrate are paracrine cells. They create effects distant to the location that they're injected at. And also remember that while they're immature, they both make very similar proteins that are biologically active. Location, technique, and centrifuging all matter to maximize our stem cell counts. Using these concepts, we have found that bone marrow aspiration is an easily reproducible 9-minute office procedure done under ultrasound guidance and local anesthesia that is well tolerated by our patient population. Please track your procedures, every one of them, so that we can all learn from each other's work. We use either the RegenMed platform or the Data Biologics platform as orthobiologic specific registries in the field. Thank you very much for your attention.